start getting even this month. And while we still have months until we defeat this virus, we know that we're going to. And we know that if we just put in the work for the remaining time. So today, I'm wearing a Get Covered 2021 mask. Kentucky is joining a broad coalition of other states' healthcare groups and health providers. Covered 2021 will be observed nationwide this Thursday. Get Covered 20 mask health practicing what's called, I think on the national level, the 3 W's, but we call it hands, face, and space. Wash your hands, wear a mask over your face, and watch your distance. Get Covered 2021 also supports covering yourself and your family. That's a reminder to renew your healthcare coverage. And if you haven't already, visit connect.ky.gov. This newly designed portal will point you to health insurance options and financial resources to help you get covered. Get Covered 2021 is about covering everyone, and we want to support efforts to increase accessible, affordable, quality healthcare coverage for all Kentuckians. Healthcare is a basic human right, and because our belief runs this deeply, we remain committed to working quickly and diligently to connecting as many Kentuckians as possible with healthcare coverage. In Kentucky, 239,000 residents are currently uninsured. 5,000 qualify for financial help to pay health coverage or get coverage through Medicaid. The help is out there. Neighbors, get them signed up, get them seeing a doctor. Face masks when we go out in public is also in Kentucky. Renew your health care coverage. More important now than ever before, wear your mask. All right, we received, and we'll put it online, this week's White House report, actually just a couple hours ago. Want to highlight a couple of things that they point out. Remember, this is the Trump White House. First, they say that this current fall to winter surge continues to spread to every corner of the U.S., from small towns to large cities, from farms to beach communities. This surge is the most rapid increase in cases. 1,000 counties of rapid increase, now entering its 8th week that we've experienced. In other words, this is a very dangerous time, and both the Commonwealth of Kentucky and the White House Task Force is asking everyone the most dangerous, most intense, most widespread surge. That means we got to say, despite and threat to the hospital systems, policies that stem the tide of the summer surge, that must happen now. This is exactly what we did. What the and then decrease our number of COVID cases. And why it is that work in July. We're using pretty much the same game plan as July. And that's now what the White House is asking every other state to do. I know one of those steps that we took, and that's moving to virtual learning until January 4th. That's a tough step, and it's been opposed by some different groups based on scientific brief supporting the step we took was sitting on, they say, is the court previously talked expert, but they say we, the American Medical Association are medical experts. And then they say this: the public health order at issue, in this case, which temporarily ordered the closure of all Kentucky schools from kindergarten through high school for in-person learning, was based on sound scientific considerations. Dr. Stack's declaration, that's what we support it with, which is the most prestigious, largest medical behind the steps that we took. The largest, most sophisticated medical association in the United States believes the reasoning was sound and is correct in the situation that we face. And it goes through in their amicus brief a number of the statements that have been pointed out from whether it's the head of the CDC or others. And then it shows their other statements. And then it shows the other writings, whether it's in CDC or other guidance, that say we had to take a big step. We had to give this virus our best punch. And we expect to have options for in-person learning, even in red counties in some form, for January the 4th. We'll work on having that guidance out, as early as next week. This was a hard decision. It's one that directly impacted my kids, but we continue to believe it was the right decision, even if unpopular, at a time when we must slow the growth of this virus. Readiness for distribution. Pending FDA regulatory approval on December 10th, shipments of the Pfizer vaccine could be received by UK healthcare and Kentucky hospitals by early next week. So this shows you, again, this was a test done around the country about how the shipping will work. It gives you the size of what the 970 odd doses will look like, and what this miracle is going to look like coming in boxes to hospitals around our state. Okay, and so let's talk vaccine. Yesterday, we showed you the shipments that we expect. So remember, about 2/3 of that, that's where we have 66% of our deaths. CVS and Walgreens are doing that schedule here in Kentucky after receiving this allocation. The other third, which we talked about, could only be shipped in very large quantities, and we only had enough to send to 11 of our acute care hospitals. 11 are getting part of that first Pfizer allocation. I can announce today that we are committed that the other 85 acute care hospitals will be allocated and will be shipped in that second week. Either Moderna, that means every hospital, acute hospital that is out there fighting this virus, second week, provided that those shipments do in fact what and up in the system. Now, there are other hospitals that aren't acute care that we will work to get this vaccine out to, hopefully as early as the third week, depending on the population that they are serving. But to you frontline healthcare workers working in these acute care hospitals where you have a COVID wing and an ER, we want to provide you help as soon as possible. This is a significant priority for us. We are so proud of the work you're doing, and we are so grateful. We're going to get as much of this vaccine as quickly to you as we can. Let's talk about one other positive piece of news, and that's where we've come in testing. So with today's report, we have now gone over 3 million COVID tests here in Kentucky. You remember back in March, I don't know how many days I stood right here and said, if you're younger, if you're doing okay, We don't have enough testing for you. Only those that could be really harmed should come in for a test. And then we only had a couple of places that could get it done. We have built in the last 9 months a system that provides over 350 testing locations that's now done 3 million tests in a state that has 4.4 million people. So it's been helping with it. Tested in the heat or the snow. And have been able to run with it. 3 million tests, something I'm not sure I ever thought that we would be at. And while we are at a concerning place on hospital capacity, the fact that we have this much testing and a 120-day supply of PPE, I hope shows you how hard that we have worked and everybody around the state have worked to give the best ability to defend against this virus and to address some of the early difficulties. All right, let's move into today's report. So today's report is always the mix of good and bad. The bad is we have 3,114 new cases of COVID-19. That's a lot of cases. It is more than we want. The good news is it's over 1,000 cases less than last Tuesday. Again, the growth in cases appears to be slowing, and we hope that holds through the rest of the week. Brings our total number of cases to 205,668. $1,760. That's up 60 from yesterday. Currently, no, that is up 6 from yesterday. Currently on a ventilator, 207. That is down 3. Our positivity rate's also down just a little bit from yesterday at 9.5. Look at new cases by county. Warren, 130. Pulaski County, 124 in Pulaski County alone. Boyd and Madison, 100. Boone, 85. A lot of counties with 20 or more cases in all parts of Kentucky. I see east, west, south, everywhere. So today's numbers on fatalities, people we've lost, it's tough in a couple. We've lost 20 additional, and 5 of them. That shows you how this is hitting people. 71-year-old man from Johnson County, a 92-year-old man from Bullock County, 3 individuals from Pike County, a 70 woman, a 78-year-old man from Hopkins County, 83-year-old man in Lee County, and a 37-year-old man in Lee County. This is one of our state inmates. An 87-year-old woman in Owsley County, to remind us that these aren't ages and counties and gender. 93 of Henderson, Kentucky, only 10 days. The striking fact about this memorial is her life was cut short by the God. Louis mask up for her. I'm going to look at that wreath we hung on our Capitol with the green lights and think about Louise And I'm going to pledge to try to do better every day in my life to protect all of those around us. To her family, we are so sorry. We mourn her. We thank you for sharing a little bit of her with the rest of us in the Commonwealth. And we pledge that we will do better. 118 new residents testing positive, 88 new staff testing positive, 41 new deaths attributable to this population. Again, all answer is that's where people are dying the most. Increases the in long-term care. But certainly in Kentucky, that percentage of our overall deaths, people in long-term care, is higher than the months. And it'd probably take at least 2, maybe 2.5, that we could potentially vaccinate everybody in long-term care, residents and staff. Now, I can't promise that because we don't know all of the shipments we're going to get and the amount, but our goal is to get it done as a loved one in that setting. Help everybody around. Are we able to? It doesn't look like we're going to be able to. About over is the result. More staff gets stretched. Texas, a lot more people. And it's not just people with COVID. If we fill up a hospital with a lot of COVID patients and the others that need help, and someone has a heart attack and there's not a bed for them, their odds of surviving are less than if we have that healthcare capacity. It puts us all at risk. What we're seeing is tight. So I'm going to go over that. So there are 10 regions when we look at capacity, and these 10 regions existed. It's a way that I think associations and others break it up and look at it. So what you see there in red are areas of the state where either the regular hospital bed, the ICU beds, or the ventilators, the percentage of those that are filled are over 80%. And that's, we think, when there is cause for concern. So let's start with the fact that no region has ventilators in that area. It appears that we are going to have enough ventilators unless this surge continues in a way and but we believe that we are going to have enough ventilator capacity. When we look at overall, one area of the state, 80%, and it's 80. Remember, these are COVID and non-COVID patients because hospital capacity in many ways doesn't care about why you're there. If you need hospitalization, you to exceeding capacity room. People who need critical care, and we need an ICU bed open for every individual that might need one. The ramifications when we don't have them are concerning. So 3 areas of our state, area 4, 10, and 8, are currently over 80%. In fact, they are 88%, 95%, and 90% full on ICU beds. Now, I know all these hospitals are working on different plans to expand them, and they are working with different regions that you see on this map. And you can read what counties fall in what regions. So what this tells me is we're in a very precarious situation. Our hospitals are working really hard. They're making good decisions about when to pause certain surgeries or open new facilities up week to week. I mean, we're talking to them just about every. This gives a concept of really seeing capacity fill up. All right, we'll have Dr. Stack talk about that as well tomorrow, fill in everything that I probably did and or said wrong because he was going to cover that today, but we were asked about this data, I think a couple days ago, and we're able to pull it together. Again, we try to provide as much data as we can. We want you to be as informed as you can. When you look at just the sheer amount that we are able to provide, cases on a daily basis, even when demographics on term care numbers, even broken down by that's on there. Now with Catherine Collins from WLEX.
Thank you, Governor. I'm wondering if you could give us an update on the latest number of backlogged unemployment claims and if there's been any increase in claims since the new set of restrictions.
We're going for the first reporter, Catherine Collins. I can't hear. This works most days. It's 2020. All right. We don't hear from Catherine. Let's see if we can hear from Shelby Smithson.
Hi, Governor. Do we have any idea of what percentage of the population needs to be vaccinated before we start relaxing restrictions and mandates and that kind of thing?
I'm going to let Dr. Stack answer that. We'll get that to you tomorrow. Certainly, it needs to be as large of a percentage of the population as we can. And I've seen some different numbers out there, but I want public health to be able to respond to that directly. Remember, with the vaccine, we know that it can keep you from getting sick or keep you from getting really sick. What we don't know is if you can spread it to other people. So we have to assume until we get that data that you can. And what that means is a large percentage has to get it. Because if a large percentage gets it, if it spreads, it's not going to make that next person sick. But if a large percentage of the population does not get it, then that creates a major challenge where people could still be harmed. I'm starting to see a major shift from people not being sure if they want to get it to really, really wanting it. And I believe our bigger challenge, as opposed to building confidence in the vaccine, is going to be asking for patience from people. If you think once we get past the healthcare workers and long-term care, our first responders, our teachers, right now there's a group called essential workers, and we have so many. And everybody's going to want it on the first day that they can to protect themselves. And that's going to be a real challenge, but it's one that we're ready to address. Joe Ragusa from Spectrum.
Hi, Governor. So in regards to the data you just presented on the hospital capacity, ICU beds, that sort of thing, how difficult was it to essentially compile all of that data on a statewide level and how much of a concern is that in regards to restrictions that you may be thinking about, or at least guidelines that you were thinking about? Do you look at more targeted restrictions in maybe northern Kentucky, where hospital capacity is much greater concern than maybe some other regions? How do you weigh that?
So it took us a couple days to compile it. Oftentimes in COVID-19, it's what can you do between 9 and 3. So with a couple days, our people can do a whole lot. Now, I think what this says to us is where we need to talk about expanding number of beds, where we need to get hospitals working with each other, and maybe a hospital system that is down the road. I don't see at the moment this changing our direction as far as restrictions and where they are this or where they are that. It does say that we need to make sure that we have options for those needing ICU beds in areas 4, 10, and 8. But if you look right around them, area 9, while it wouldn't have as many ICU beds as, say, the Louisville area, has room. And if that means we've got to transport, provided that we can, some patients that are in 10 to area 3, I know that people are ready and willing and able to help, and we are seeing more cooperation between hospitals and hospital systems than I can ever recall seeing. I mean, they have been willing to step up to this challenge and throw out all the old norms, and it's a real credit to them. Debbie Yetter from the Courier-Journal.
Hi, Governor. I wonder if you could address how nursing homes will get the first shipments of vaccines. Will everybody get some level of vaccine, or have you prioritized it like hospitals?
So the challenge here is that many of the decisions, but not all, will be made by CVS and Walgreens that have the contract with the federal government to provide these vaccinations. And we have to use that partner, but they're sophisticated. They're going to be able to handle the Pfizer vaccine, and we have confidence in them. They are going to start with the highest level of long-term care, the nursing homes, before, say, they get down to assisted living. So I think that there are broad categories of need in which you can clearly identify facilities, but it may not be that every facility within that top tier gets vaccines on that first week that CVS and Walgreens is doing it. Now, CVS and Walgreens has a ramp-up period that is a week to 2. We hope it's less than 2 from when that first shipment comes in to when they are in the facility. So during that period of time, we ought to have gotten at least a second shipment. I certainly hope that that shipment gives us another significant number that we can put into that program. But it's what's going to be hard, is that you're going to have everybody that has almost the same need because they're at the same risk. And not everybody is going to get it at the same time. It's going to be something that's going to be difficult. It can't be avoided because we don't want to hold back vaccine that we have for even a day. So it's going to be one of our challenges moving forward, and we're going to have to ask people for more patience than they have ever had to exhibit, even when they're concerned for their own safety and their own lives. Tom Latek from Kentucky Today.
Hey, Governor, how are you this afternoon? You've spoken about the long-term care centers and even teachers and what have you getting the vaccines early on. We've had several breakouts in prisons and jails. Where do they stand on the priority list for getting the vaccine when it becomes available?
They are not in the top several groups of priority. Now, the corrections officers are. They are in the first couple groups, and if we can get the corrections officers vaccinated, then hopefully we can lessen the spread in those facilities. But we got to get to our healthcare workers. We've got to get to our long-term care centers, our teachers, other essential workers. Those will all come first. Josh James from WUKY.
Hi, Governor. This is thinking ahead a little bit maybe, but is there any difference in guidance for those who have recovered or are recovering from COVID-19 as far as vaccination is concerned?
I believe that the CDC and others will recommend that everybody get vaccinated. It does appear that you can get COVID-19, at least some people have, more than once. We believe that, at least initially, experts believe that the vaccine will provide you greater protection than having had it and gotten over it. And so we will await some of the official word on that, but we believe it will be that everyone, including those who have had it, should get the vaccine. Jennifer Brown from the Hoptown Chronicle. We'll give Jennifer one more minute.
Can you hear me now, Governor?
I can.
Thank you. Yesterday, Hopkinsville Police filed a report about a social media post that the county health department saw as a threat against one of its employees. This coincides with a local restaurant continuing to operate in a tent despite having its food service permit suspended on Friday. My question is two-part. First, what is the state doing to address resistance and threats that local health officials experience when enforcing Kentucky's COVID regulations? And second, do you think the resistance has reached a level that in effect diminishes the authority of county level health officials?
Well, certainly on the state level, any and every time there is a threat like that, it should be turned over to law enforcement who should pursue it. Our local health department folks are heroes. They are fighting to save people's lives even when they are called names and threatened. And regardless of where you fall on COVID or the steps you think we should be taking, you should condemn threats made against your neighbor, especially those fighting this in the front lines, and you should do it right now, all day. These are people that deserve our protection. It is absolutely unacceptable. And folks out there who would even think about this, how to read their Bible, talk to their pastor. You know, there's right and there's wrong, and there's good and there's evil. And again, regardless of what you think about COVID, threatening a local health department official is not good, it's evil. It is wrong. And stop it. Stop it. Whoever's out there doing this, stop it. You don't get to threaten people outside of a pandemic. You don't get to threaten them inside a pandemic. Our society doesn't work that way. You do not have the right to make other people fear for their safety. You do not. That is not an American liberty. That is not your freedom of speech. And in many cases, it's criminal. As far as those that are continuing to operate, even when a Supreme Court has said that the orders we've put out are valid and carry the rule of law, yeah, you're diminishing not just the authority of a state or a country during a pandemic. You are diminishing the rule of law that's one of the bedrocks of this country. If you say you love America, part of America is the rule of law. It's what allows us to be a peaceful society. And your position now that everybody is seeing is, I'm not going to follow any law I disagree with. And it may be creating real financial hardship. But is our rule now that if something creates financial hardship on me, I don't have to do it or I don't have to follow the law? There are going to be long-standing implications for what we are seeing right now. And this concept that liberty under the Constitution means if I disagree with something, I can do whatever I want. That is un-American. It's not American at all. and people should be better than that. You know, my grandparents come from just on the other side of the penny and I keep thinking what my granddad would think and or preach during this. Caring about your fellow man, doing the right thing. He would expect us to be better than what we're seeing in some places. I'm sure he'd be willing to go talk to whoever is making that threat and telling them what he thinks the Bible says about those who would do something like that. Melissa Patrick from Kentucky Health News.
Hi, Governor. So the latest White House report says primarily those with symptoms are being diagnosed, and that aggressive testing to find asymptomatic individuals responsible for the majority of infection spread must be scaled. So what is Kentucky's plan to get more of this group tested?
That's why we now have our 358 locations, over 3 million tests, encouraging on a daily basis for everyone to get tested regularly. Now, what we have to accept is we can't force people to get tested. And sometimes you'll hear theories that we should do this and that for the purposes of our data. You can't force people to get tested, and we're not going to do that. But what we can continue to do is encourage people, especially who have regular interaction with the public, to get tested regularly. And right now we have groups that are getting regularly tested across the Commonwealth, depending on their jobs. We get tested every 2 weeks here in the governor's office. We've offered that to other state officials as well. We know that there is regular testing in our universities with their faculty and other staff. We know local health departments are out there pushing for that testing. And based on what we're seeing in the total numbers versus the positivity rate, we know a significant number of asymptomatic people are getting tested at any given point. But remembering that encouragement is what we can do in the area of testing, and the volume of our data, I think, helps with that. Now, one of the things that the White House talks about a lot are some of these rapid tests, and they believe in them, and they can be useful, and we are using them in some different places. But they also have the highest error rate, and so we're trying to be judicious about how to use them and what the implications can be with that error rate. But certainly we are making plans right now, regardless of what the federal government does, to extend testing through January as well. It's going to be hard. It's going to be a budget hit on one of my cabinets. But we'll go from the White House wanting everybody in the country to scale up testing of asymptomatic people, which is what they're asking us to do right now, to having zero funding to do it in January. I mean, that's highly, highly concerning. So I do hope those that put together the White House report are talking to the president and talking to Congress, saying we got to get some help now. Now, of the two proposals that are being discussed right now, one of them doesn't have any money for testing in it whatsoever for state and local governments. That's got to be a non-starter. So we'll hope that they do the right thing. The bipartisan proposal isn't perfect, but it's a start. I would certainly endorse that over the other proposal. Do we have Catherine Collins, who we were trying to start with? I want to give one opportunity.
Can you hear me?
I can.
Logged unemployment claims, and wondering if there's been any uptick in unemployment claims since these new restrictions went into place.
We can get you those numbers. I believe the last numbers we have on the backlog that are considered a part of the backlog are from October. And October's numbers, when they're added at the end of every month, when the previous months are added, obviously that's claims coming in as we get claims resolved and going out. The other challenge we have, because you think about this as you've had this many claims and you've had this much time, how are there still claims here? Well, those aren't the only folks that we have to help, because the system the federal government set up makes you request your benefits often. and re-request them and re-request them. And basically what they know is that a certain number of people are going to commit errors doing that. And I believe the federal system wants those people to be frustrated and not get their benefits. So every day that we're working on addressing that backlog, we're also helping people who have received initial benefits, but they may have stopped because of this difficult system under current law. And so that's a real challenge on the manpower side, but we are continuing to work with it. The public can also expect that the budget that I submit in January is going to have significant funding for additional personnel, at least the 90-something that were cut several years ago. They're going to include the cost to reopen the satellite offices that were previously closed. And they're going to include whatever is necessary for a full upgrade of the system. We put about $6 million to help during the pandemic. The system, you can't let a system get 20 years old. I mean, just getting basic information out of it is difficult enough. And the age of that system and its inflexibility and its difficulty has absolutely added to the difficulty in resolving those claims. With the modern system, we wouldn't be in nearly this situation. With the modern system and necessary staffing, we'd be in an even better place. All right, no one said we always had to take up the full hour. A lot of cases today, less than last week. Again, we hope and we believe that the exponential growth that we are seeing is slowing. And we absolutely believe that the steps we are taking are the primary factor in that slowing of growth. Why do we know that? Because we did it in July and it worked. Because the federal government has watched every other state in exponential growth that's willing to take these steps. And now it's saying everybody else around the country needs to do exactly what we have done. Yes, it requires sacrifice. Yes, it's unfair that that sacrifice is more on certain businesses and individuals than others. But this virus isn't fair. And we got to do what it takes to defeat it. And we've got to work to try to help those that are impacted the most. I'm continuing to push the federal government to provide real relief to these businesses, not just another payroll protection plan, but direct financial relief. I know those loans can be forgivable, but right now, people need direct financial infusion. Okay, I appreciate y'all sticking with us today. Let's keep it up. Remember, if you're a group that's going to be able to reopen something on Monday, get plans in place to enforce that mask mandate. That's the only way it's safe inside the facility. And I hope and I pray that you want your facility to be safe. We showed in July that we can do this. We got to do it again. Our hospital capacity is depending on it. And these vaccines are so close. And we know we're now dealing with months, probably late summer at the very latest, where we can protect everybody who wants to be protected. So let's get there. Let's save one another. Let's be good members of Team Kentucky. Thank you all very much.